Hello, everybody. It's a great pleasure today to be with you. Thank you for the invitation, and I'm very glad to share with you some of the findings of my research. Uh, I have changed a bit the title of my presentation. I'm going to illustrate Italy's population scenarios for the 21st century, having in mind especially the assumption behind this projection, and especially the assumption related to fertility trends in the future. So today my presentation is divided into two main parts. So I'm going to describe population prospects of Italy till the end of this century by comparing different scenarios stemming from different projections made by different institutions, and also outlining the change in population age structure that is deriving from this projection. In the second part, I will make some consideration on the assumption, especially concerning fertility behind these projections concerning Italy, considering whether this idea of persistent declining fertility, which was embedded in the concept of low fertility trap, a downward spiral of low fertility over time, would be reflected in any of the assumptions made in the population projections for Italy. And in the end, the question will be whether this implementation of the low fertility trap hypothesis into the assumption of the projection would be justified by the emergence of the low fertility trap in Italy. So to begin with the motivation of the research, the ongoing research, I'm sure you know that Italy is the country with one of the lowest fertility levels and the highest life expectancy, a combination that will produce tremendous impact on the labor market and pension system and healthcare provision in the future. So the need to know the future is very important for the government and for the firms and for the society as a whole. But on the other side, we have to say that in the last years, especially due to the COVID pandemic, the uncertainty related to the future trends in births and deaths has increased and has made consequently the demographic projection more challenging. This gave us the motivation to look more closely in depth into the different projection delivered by different institutions. So what I'm going, in the next slide, what I'm going to share with you are some findings included in a forthcoming publication. Is a joint paper with my colleague Claudia Reiter from University of Vienna and Anne Goujon from the International Institute for Applied Systems Analysis in Luxembourg, near Vienna. And the paper is Italy's Population Prospect, Future Scenarios for the 21st Century. That is going to be published in Rivista di Economia Italiana. What is the idea of this paper is just to compare population projection coming from different institutions doing projection. As you may see in this paper, in this slide, in this table, we have United Nations projection, the Wittgenstein Center for the Demography and Global Human Capital, the projection made by the Institute of Health Metrics and Evaluation, the Eurostat projection, and the ISTAT projection, the National Institute of Statistics in Italy. The base year is different. These are all the most recent available projection, population projection, delivered by the corresponding institutions. And the years are of course different because they have produced at a different time the projections. The period of projection is the same, so ends at in all cases by the end of this century, but ISTAT ends the projection in 2070. The methodological approach is different, is deterministic for big Wittgenstein, IME, and Eurostat. Only the Wittgenstein Center include this multidimensional approach, so consider beyond, besides age and sex, also education, also in the assumption, not only as outcome. While the United Nations and ISTAT from several years, they have started doing probabilistic projections. So they attribute a given probability to the realization of a given projection outcome. And they delivered confidence interval at 90 and 80%, ISTAT also 50%. The assumptions are also different, and the methodological approach is also different from institution to institution. United Nations based the projection on historical trends, so observation of the past. The Wittgenstein Center based the projection on expert assessment. They have collected pretty many expert opinions. IME based the assumption on statistical model and function of other variables. Eurostat assume a convergence between the EU member states in all variables of demographic change. So this is the main assumption of Eurostat, and ISTAT again has also adopted this idea of asking experts about the future trends of mortality, fertility, and migration. The number of scenarios is different. The number is higher for the United Nations and lower for the IME. And in our paper, we selected the central scenario, so the middle of the road, the scenario that is considered the most likely scenario among the options that are outlined. You will know that the projection respond to the logic what if. So they don't pretend to be realistic, to be as much close to the reality, but they just draw up a scenario responding to a given assumption, to what will happen if we assume that fertility, mortality, and migration will be at this level. And as you may see, the terminology is a bit confusing because for this central scenario, I use different terms, the medium variant for the UN, the SSP2 scenario for the Wittgenstein Center, the reference scenario for the IME, the baseline scenario for the Eurostat, and the median scenario for the ISTAT. I have to say, maybe it is not known to all of you, the Wittgenstein Center provide national population projections on assumption concerning not only fertility, mortality, and migration, but also education. And the scenarios that are outlined follow the shared socioeconomic pathway. This is the SSP, socioeconomic pathways, that were designed together with the International Integrated Assessment Modeling Community to support the work of Intergovernmental Panel on Climate Change. And these number 2 socioeconomic pathway correspond to a medium scenario that foresees a medium expansion of education based on global trends, and also a medium trend in mortality, fertility, and migration. Here are some results. You see in the part of the estimate starting from 2020 onwards that only some lines are continuous. These correspond to the medial or central scenarios of each of these institutions. And as you may see, population of Italy is most likely going to decline in the coming decades. What is, according to the central scenarios of the different institutions, what is interesting is that the prediction of ISTAT which foresee a decline of 11 million people by 2070, is lying in between the prediction of the other institution. Eurostat and Wittgenstein Center are more optimistic, predicting a decline of 4 and 6 million people by that year, and United Nations and IME are more pessimistic, predicting a decline of 13 and 16 million people by 2017. And another result you can read in this graph is that, of course, the more we go ahead in the future, the wider becomes the spread in the options of the projection. The decline of population has already started in Italy in 2014. So it will be a continuous trend of what we have already observed in the last years. What about the population structure? Here you see in the 3 lines the outcomes stemming from different institutions doing projection for 2030, 2050, and 2070. In the middle, you see ISTAT, because it is also the middle of the road in terms of outcomes. We can go through the reading in a vertical direction, and we see that the age structure, that here it is emphasized in the 3 main age groups, 0-14 in the blue dark color, 15 to 64, the working age population, that it is color in turquoise. And at the top, we see the yellow area, the people above, at and above age 65. So the old segment of the population. And if we go in the vertical sense, starting from the top, we see that the age pyramid of Italy is will get this muffin shape by 2030, with a very large top, very large share of people in the old ages, and they will become almost 1/3 of the population. And it is projected to become like a beehive. I see that this is a very commonly used term to depict the future age pyramid of high-income countries. And well, by 2070, it will be a coffin. So really a shape like very tiny share of the basis and also of the central part. This is the there is a much concern in Italy these days on the decline of not only of the population as a whole, but also of the segment of the population in the working age. Of course, this decline will involve also this population. And by 2050, we are projected to lose, according to the central scenario by ISTAT, already 7 million people in the working age group. Now, if we compare the outcome of ISTAT with the other outcomes as delivered by the other institution doing projection, you see that in comparison with the central scenario of ISTAT, the two scenarios depicted by the IME and the United Nations are showing even a more pronounced decline of working age people, and also an increase of a more pronounced increase of people at the top, so at the top of the pyramid, so above age 64. While more optimistic, more conservative are the predictions of Eurostat and Wittgenstein Center, and we will see why in a while, why they are so more optimistic. They are strongly depending on the assumption they are making on the three drivers of population. One aspect that I really like to emphasize also in the context of this seminar is that the assumptions are made at the national level. And even with this assumption made at the national level, we will see in the next 50 years, a pronounced difference in the population annual growth rate in Italy. Here we compare the projection of Eurostat, which deliver also the outcome at provincial level, with those of ISTAT, always central scenario, which only deliver the outcome at regional level. And as you may see, there will be pronounced differences in the growth rate in the Italian region or provinces. We see that there are especially regions and provinces in the south of Italy to be affected by the stronger decline of population, while there are regions and provinces in the central north part of the country that are closer. There is this green color that is standing for zero growth. And even one province, Trento, la provincia autonoma di Trento, is projected to still increase in terms of population, its population in the next 50 years. It's not a coincidence that Trento is also having the highest fertility levels, with 1.6 children per woman, the highest in Italy. While in the southern part of the country, we have the lowest, at the moment, the lowest total fertility rate. Sardinia has the lowest TFR, with just 1 child per woman. So no longer, in the past was the south, the more prolific part of the country, and nowadays we are observing a different trend, a different territorial path, and this will have repercussion, as you may see in these two maps, in the future trends. But the differences are still here. We are not going to project a convergence in Italy in terms of population trends. What about the assumption? I have already underlined that projection responds to the logic what if, so they are really responsive to the assumption. Concerning the mortality side, the assumptions are not controversial. So they are assuming, all institutions are assuming a continuous increase in the life expectancy, a remarkable increase if we think that by 2070, concerning the life expectancy at birth for women, they will, in many cases, they assume, the projection assume that this life expectancy will be higher than 90 years, and 90 years was considered several years ago like the maximum threshold that could be achieved. Not controversial, as I said, because this path would be fully coherent with what we have observed in the past 70 years. We have a continuous increase in life expectancy among men as well as women. And actually, we had a gain of 3 additional months each year for both sex. And the only exception has been the last year, because we have lost 1 year in the life expectancy. It cannot be seen very clearly because I just reported the estimate every 5 years, but we just had from 1 year to the next a loss of 1 year in the life expectancy at birth for both sexes in 2021 as compared to 2020. The more controversial are the assumptions made by the different institutions concerning the fertility trends. So as you may see in the table, all institutions hypothesize an increase of fertility till the end of this century. I remember that the current level is 1.25. So 1.25 children per woman, the last estimate in 2021, the national level. And here you see that all but IME Institute, they all predict an increase in the rest of this century of fertility. So how solid, how could be justified this? Well, there are several reasons. The idea is that women are postponing the start of the first child, and then the start of building a family, and this at some point could be recuperated and will be observed in an increase of TFR in the years to come. This could be one issue. There were other reasons behind this assumption of increase in fertility levels that were stemming from the idea that a more gender equality would be a push towards an increase of fertility levels in the country, and not only in Italy. And also the other issue was that actually at certain point, if Italy would start again a period of economic expansion, this would be also a push towards an increase of fertility, because one of the ideas is that in the after having reached a given level in the Human Development Index, the correlation between the development and the level of income, the situation in which couples are, would be positively correlated with the number of children people have. So in those countries like Italy, which have already reached a given stage of development as measured by the Human Development Index, we would see a reversal path of fertility. Would be the couples with more resources, those who are opting more frequently for a second child. But this idea would have a condition: if there would be then enough couples in good economic conditions. So I see, in my view, that this hypothesis of increasing fertility toward the rest of the century is anything but obvious at the current stage. And even in terms of recuperation of postponement, because I have just heard in the one of the keynote speeches at the EAPS assembly last week, that the last cohort fertility estimates for the women born in 1980 in Italy is 1.45. And as you may see in this table, the trends depicted, it goes far beyond this level of current cohort fertility, which is 1.45. And also historically, it's very hard to justify this increase, but because, as you may see in the estimates as reported by the UN, actually total fertility rate was on decline since the 1950 in Italy. There was only a period, a small bracket in the first decade of this century where it went again up, but this was the contribution of immigration. So we do not have reason to think that it could be a permanent, enduring phenomenon, but I'm willing to discuss and to with you in maybe in the Q&A session. Okay, and the other controversial standard issue is the assumption related to migration, but in this case, it is a difficulty related to all projection for all countries, because as you may say, as you may know, it's very difficult to predict the migration flows. The reason behind these flows are very uncertain and may change from year to year. And what I see here in this graph is a variation between, again, the optimistic scenario outlined by Eurostat, which foresee annual 200,000 net migration in Italy till the end of the century. And at the opposite, we have the assumption of IME, which hypothesized a much smaller net migration at the level of 80,000, going down to 28,000-30,000 by the end of the century. ISTAT is assuming a net migration of 130,000 per year, but again, is anything but obvious in these days, especially in times of in hard economic time, recession time. So here is the outline of the path for migration in Italy. It's very difficult. You may see in the two components of population change, the natural increase in the dark blue color and the net migration in the gray light color. And you may see the trend of net migration, the big contribution given to the population change in the last 2 decades of this century. But well, this trend has been on decline since the 2014. And this was also the reason why the Italian population started to decline, because the positive net migration was not more able to more than counterbalance the negative natural increase, the excess of deaths over births. Here you see the deviation. So how they stand these outcomes each other. So what is the comparison to enhance the comparison of the assumptions behind the population projection? We just standardize the comparison, putting the UN assumption equal to 0 for all the three drivers: fertility, mortality, and migration. And here you see we are now switching to fertility issue. We see the fertility is really, well, all the institutes but IME, they foresee an increase of fertility as compared to the United Nations assumption. So to what extent, this is the current question, to what extent are the fertility hypotheses behind population projection realistic? I just start with some consideration that led me to start with another piece of research, of which I will show you some preliminary findings. So increasing fertility, this is the question, the open question. But what we observe in Italy nowadays is a slowdown, in the most optimistic way, is a slowdown of economic growth, in increasing postponement, not only of fertility, of the start of family, but all the stages that make the transition to adulthood. There are many people that are not young, people that are not reaching an autonomy, economic autonomy. We have reached 3 million needs people, young people between 19 and 35 years who are not in education, not in employment, and not in training. We are the champion in Europe, with more than 30% of these young people not working and not studying. So these, of course, clearly postpone all the steps in the transition of adulthood, the living in a new house with a partner, and then also possibly start a family. The uncertainty is a big topic. Any paper addressing fertility nowadays in Italy is really focusing on this increasing uncertainty. It is a job uncertainty. It's more widely an economic uncertainty, so related to the context, the surrounding context. And it is more than that because of the COVID pandemic. It is an uncertainty related to the life as a whole. So the uncertainty related to the health condition, to the possibility to still hold the relationship with their parents and the grandparents, help in the care of the children, which is a very important way in which the Italian young couple provide these, combine the task of caring for children and working on the labor market, especially women, because we are far away to this gender equality in the share of the task in terms of caring for children, especially young children in the age 0 to between women and men, between the partners. So on one side, we see this assumption of increasing fertility. On the other side, in point 2, 3, 4 up to 5, we don't have at the moment any sign of a recovery of fertility, of a reversal trend, but I would be happy to hear your opinion on that. And what I was convinced is that indeed we still now have a kind of something more than an economic change that drives the fertility decline in Italy. Because our parents, the people born in the Second World War, were also not certain of their future in all respects. So my idea was to just try to investigate the change also on a cultural size. And this is the question now. This was the research that is not at a mature enough stage to be circulated in a paper. I can certainly circulate my paper on Italian projection. The idea is to monitor, to observe also a cultural change as a driver of fertility change in the course that are, pioneer or forerunner of this change. So we have conducted at the university where I'm teaching, Lewis University in Rome, which is a private university, and is a survey that is asking students, female and male students, a set of questions concerning their life plans related to work and family, to just come up with some cultural models and value systems among them. And we also collected information on their socio-demographic characteristic of their family. So we interviewed 1,553 students between January and February 2022. The response rate is not that high, but it's, pretty okay. The questionnaire was administered via web, and we had some preliminary results, which I want to share with you. So to the survey question, how do you value the following aspect in your life? Family, love, study, work, faith, politics, sex, fun, money, beauty, culture, sport, friendship. On a scale, they were required to indicate on a scale going from 1, not important, to 5, very important. We got that the family got here, it is displayed on the left side of this graph, is got the higher score at 4.5 approximately for both males in turquoise color and females in red color. The other important aspect in their life indicated by female and male students were the, previous here was the culture and also the friendship. So family is still important, is still at the top of the values for the students at university, but family can be also considered as the family of origin, can be considered also in both sense, my own family in the future, because they are students and they are childless, but also the family of origin. So we administered another two questions to understand how much important for these students would be the realization of a family with children, and what is the preferred family size for these students. And here you see the distribution of two variables stemming from two questions. The one in violet is the answer to how many children do you expect to have at the age of 45? And you see none, 1, 2, 3, and above 3. And more than half of the students interviewed in this survey indicated a family with 2 children. If we use another variable, the number of ideal family size, so how many children would be in an ideal family size without any obstacle that you can foresee or imagine to the realization of this ideal. In this case, you see the distribution is even more towards the 3 children and above 3 children. The sum of these two categories is more than 1/3 of the interviewed people. So 1/3 of the students indicate this big family, I would say large family, above 2 children, the ideal family. Of course, the ideal are far away from the reality, and we know there is a discrepancy. The issue becomes here, the most interesting part, finding of this survey has in this ordering of the life plans made by the students. It is still true that for them it is important, the family. Family is a value. Family is ideally still a large family, as they in the Italian past style also feature in television, in the media. But when it becomes to the concrete planning, to the arrangement of the different achievements they have planned for their life, the ordering is, well, I want first to complete my study. I want to start a work, a solid work, so something that it is not precarious, because it should be a job that gives me a very pretty good financial well-being. And then I can think about going to live with my partner in a new home. And finally, I will be ready to have children. So this also, this sequence of priorities in the target they have to achieve, in the achievement they just plan in their life, makes clear that we should also try to measure fertility plans, fertility goals, fertility intention in a more flexible way. And this is the challenge for the future. So to conclude, diverging trends in Italy nowadays. On one side, we are having fewer and fewer young people. So young people are becoming rare. Some demographers are really really delivering this message also in the media. And we will be fewer, there will be fewer in the coming decades. But on the other side, family with children is still a likely option for young people's self-realization. Family is still very important. Well, I show in my little survey on the students, but there are other pieces of evidence. So the end of the crisis could leave room for a reversal of fertility decline. But the point is, what's this, when and this crisis would stop to produce its effect. And if this will happen, we could really see a speed up of the earlier stage of the adult life trajectory, and as a repercussion, and positive impact on actual fertility levels. And only in this case, the projections underlying assumption could come true. So this is my conclusion for my seminar. The low fertility trap hypothesis, this downward spiral of low fertility, is not yet at stake in Italy. We do not have sign to really support with empirical evidence this downward mechanism stemming from the ideals, from the intentions. But on the other side, there are some institutions like IME already implementing some of the idea of the low fertility trap while depicting this persistent declining trend of fertility in the years to come. And with this, I stop my presentation, and I